Good morning and welcome to the October meeting of the U.S. Advisory Committee on Immunization Practices. We thank everybody for being able to attend, and we look forward to an interesting and information-filled meeting. I'm going to turn things over to Dr. Pickering to get us started here.
Good. Thank you, Dr. Temte. And again, we also welcome you to the October 2014 ACIP meeting. The proceedings of this meeting will be accessible to people on the World Wide Web, so we welcome those out there in World Wide Web land who can't join us in person. Several people will be with us and assisting during the course of the meeting. Stephanie Thomas, Natalie Green, Reed Walton, and Chris Caraway. We've got a full agenda today and tomorrow, and we'll adjourn today at approximately 5:45 and tomorrow about 1:15 if Dr. Temte can keep the agenda online. Handouts have been provided to all of the ACIP members, and they're also available for the rest of us on the table outside of the auditorium. Slides presented at this meeting will be posted on the ACIP website approximately 2 weeks after the meeting once they're made 508 compliant. The live webcast of the meeting will be posted within about 4 weeks. And then the meeting minutes are posted on the ACIP website generally within 90 days of the meeting. The June ACIP minutes were 172 single-space pages, excellent reading. They will be posted next week. The minutes for the extra meeting we had in August for pneumococcal vaccines have been posted to the ACIP website. This meeting would like to welcome several international guests. We have international guests at each meeting. Dr. Aisha Muhammad Al-Shalmari is here, is the manager of the National Immunization Program for the Ministry of Health in Saudi Arabia. If you could just stand and we could recognize you. Thank you for being here. We also have two visitors from the Centers for Disease Control in Taiwan, Dr. Shulun Lo and Dr. Yumin Chao. Dr. Lo is the section chief of the Division of Acute Infectious Diseases, and Dr. Chao is the deputy director of Acute Infectious Diseases, and again, we welcome you. As a reminder for future international visitors to the ACIP, there have been many changes in the Department of Homeland Security that directly affect us. Additional forms are required for each meeting at the time an international guest registers, and it's absolutely critical that international visitors to the CDC and to ACIP complete and submit these forms as soon as possible following registration. Stephanie Thomas, the ACIP Committee Management Specialist, who is in the back of the room, will be able to help with any questions and concerns. And the forms for registering for the next meeting will be online this Friday, so people who need to register can do that. Then it's finished and you don't have to worry about it and clearly won't forget to do it. We always have a few international visitors who call at the last minute, and it's absolutely impossible for us to do anything to help, although we do try. Two of our ACIP members, Kathy Harriman and Douglas Campos-Odcalt, are unable to join us for this meeting, but they told us they will be here in spirit. For this meeting, Tammy Thomas is attending for Patsy Stinchfield, representing the National Association of Pediatric Nurse Practitioners. Tammy, welcome. Any questions you have, we'll be glad to help answer them. We also have a new liaison representing the American Nurses Association. Chad Riddle will be replacing Katie Brewer. Chad, are you here? Okay, good. Welcome. There's a new liaison representing the Canadian National Committee on Immunization. Ian Jamil will be replacing Brian Warshawski. Ian, are you here? Okay, good. Welcome. Good to have you. The Healthcare Infection Control Practices Advisory Committee, known as HICPAC, has withdrawn as a liaison organization to the ACIP, but still will be available for any consultation that they can provide. We request that all cell phones be turned off. Topics presented at the ACIP meetings include open discussions with time reserved for public comment. The public comments are stated at the end of each day. However, if there is a vote on a specific topic, then public comments will be taken before the vote so that ACIP members have an opportunity to consider those comments. People who plan to make public comments should visit the registration table at the rear of this auditorium. Stephanie Thomas will record your name and provide information on the process. People who make public comments will request three things. One is their name, organization, if appropriate, and any potential conflicts of interest. This is a 50-year anniversary of ACIP, so it's a big celebration time. We held the first meeting of ACIP. Some of us weren't around then, but the first meeting was held in May of 1964 in a building that no longer exists. Dr. Frieden will be joining us in a few minutes to commemorate this notable anniversary. An article entitled "The History and Evolution of the ACIP" was published this week in MMWR, and there'll be another article in Vaccines, which is a little more extensive, History of the United States Advisory Committee on Immunization Practices. It's surprising some of the knowledge deficits about ACIP people have. These, along with attending the meetings, of course, are very helpful in filling those in. Safety issues. Safety issues will continue to be presented at every ACIP meeting. Separate vaccine safety presentation will be given here tomorrow. Disclosures, which are important. To summarize conflicts of interest provisions applicable to the ACIP, as noted in the ACIP Policies and Procedures Manual, members of the ACIP agree to forego participation in certain activities related to vaccines during their tenure on the committee. For certain other interests that potentially enhance the members' expertise while serving on the committee, CDC has issued limited conflict of interest waivers. Members who conduct vaccine clinical trials or who serve on data safety monitoring boards may present to the committee on matters related to those specific vaccines. However, they are prohibited from participating in committee votes on issues related to these vaccines. Regarding other vaccines of the concerned company, a member may participate in discussion with a proviso that he or she abstains from all votes related to the vaccines of that company. It's also important to note that at the beginning of each ACIP meeting, in just a moment, Dr. Temte will ask for conflicts of interest from all of the ACIP members. Now, slide number 5 on the screen shows the ACIP website where detailed instructions for submission of names for potential candidates to serve on ACIP as members may be found. Applications for ACIP membership are due no later than November 14th for the 4-year term, which begins next year in July of 2015. At every meeting, we provide an update on the status of the ACIP recommendations, and a list of these recommendations is shown on this slide. And there have been 4 publications since the last meeting. Use of meninge ACYW vaccine in children 2 through 23 months of age. Secondly, influenza vaccines for the 2014-15 season. Thirdly is recommendation of HPV vaccines, and this was a pulling together of all the HPV recommendations that are out there into one document. And then lastly, is shown on slide 7, use of PCV13 and PCV and polysaccharide vaccine 23 in adults. And this was the recommendation that ACIP made at the August meeting. We want to highlight on the next slide the recommendations for PCV13 in adults, which were made by ACIP in August, as I said. The work group, I think, did an absolutely wonderful job in designing this algorithm that can be seen. It is in the article and is really very clear on how these vaccines should be administered. Vaccine recommendations and immunization schedules can be downloaded from the ACIP website. ACIP has a policy that every 3 to 5 years, each recommendation is reviewed, and then it's either renewed, retired, or reaffirmed. At this meeting, we'll hear the 1994 typhoid recommendations, which will be updated. This is the grandfather of belatedness. These will be updated during this meeting, and then we'll be fairly caught up to speed. And lastly, I'd like to make one comment. Many of you are aware that our friend, colleague, and former ACIP member, Mike Marcy, died on September 5th, 2014, after a battle, very short battle, with cancer. At the time of his death, Mike was clinical professor of pediatrics at both USC and UCLA. Mike served on the ACIP from July 1st, 2008 to June 30th, 2012. Committee chairs during Mike's tenure were Dale Morris and Carol Baker. While a member of the ACIP, Mike served as the chair of the pneumococcal work group and a member of the HPV and meningococcal work groups. Mike was nationally and internationally known. On the next slide, you can see Mike, recognized in the field of pediatric infectious diseases. He was a member of the Red Book Committee for the American Academy of Pediatrics and a recipient of many awards, which I won't mention because there are way too many. Mike was a unique ACIP member in that, interesting, he arrived in Atlanta 1 to 2 days before each meeting to read all of the extensive material and information provided to the members before each meeting. And as we all remember, during meetings, the discussion in which Mike was involved were always very stimulating. Mike is survived by his beloved wife, Joan, and his 2 adult children, Stephanie and Josh, and by all of us who remember Mike's memory. We're sorry that Mike is gone, but we're very happy for what he has left us. Thank you, Mike.
Thank you, Dr. Pickering, for the wonderful message on Dr. Marcy. I'm going to start out by just taking a roll call and going around, starting with Ms. Pellegrini and any conflicts of interest.
Good morning, Cindy Pellegrini, no conflicts.
Good morning, Art Reingold, no conflicts.
Marietta Vasquez, no conflicts.
Joe Bocchini, no conflict.
Allison Camp, no conflict.
Ruth Karen, no conflicts.
Ed Belongia, I receive research funding from MedImmune.
Lee Harrison, no conflict.
Jose Romero, no conflict.
Lori Rubin, no conflict.
Nana Bennett, no conflict.
And Jon Temte, no conflict. At this point, I'm just going to make a few comments here, but I want to, in this very public arena, just make an expression of gratitude to all the people here at CDC who have been working nonstop over the last several months in terms of the response to the Ebola outbreak in coastal West Africa. A number of the people that we're used to seeing who are subject matter experts that help us out here have been called over to help out either domestically or in coastal West Africa. But again, the number of hours put in is just unimaginable. This goes all the way from the top administrators all the way down to the Epidemiology Intelligence Service fellows. This has been a agency-wide, and we appreciate your efforts. That being said, we are now at the 50th year of ACIP, and I'm going to just do a real quick review here. Next slide, please. If you're not aware, in the recent MMWR is a history and evolution of the Advisory Committee on Immunization Practices, authored by Gene Smith, Alan Hinman, Larry Pickering. And so if you're interested, this is easily available and gives kind of a rundown. Next slide. I thought I would just very quickly go over the who, what, where, when, and why of ACIP. So this is my excuse to introduce our new members. So next slide. First, Ed Belongia. Ed is the director of the Epidemiology Research Center at Marshfield Clinic Research Foundation. If you don't know, Marshfield, Wisconsin has a population of about 30,000. I think you're probably the representative from the smallest city of all of us.
I think we have more epidemiologists per capita than any other city in the U.S.
I think that's true. So Ed is a nationally recognized expert epidemiology, influenza vaccine effectiveness, antibiotic resistance. I've known Ed for probably 15 plus years, getting started with the Wisconsin Antibiotic Resistance Network, otherwise known as WARN. But Ed has also been principal investigator in the Vaccine and Safety Data Link from Marshfield Clinic, and has worked a lot with the influenza vaccine efficacy network as well. So we appreciate having his knowledge and expertise here. If you can hit the button one more time, my apology to Ed. If you can hit the, this is Ed's, I have to do this just because Ed, there's rarely two Wisconsin people here at the same time, so Ed's alter ego here.
Just to be clear, that is not me.
Next slide, please. Laura Riley, and Laura, I'll just have to mention, I don't have any pop-up slides or pictures of you coming here, so you can sit back and relax. Laura is the Director of Labor and Delivery and Obstetrics and Gynecology, Infectious Disease at Massachusetts General Hospital. She has a lot of interest in HIV disease and pregnancy, infectious disease complications in pregnancy, medical complications of pregnancy, and high-risk pregnancy as well. If you're not aware, Laura has been the liaison previously for ACOG to ACIP, and I believe she is the very first obstetrician gynecologist to serve on ACIP, pointing to the increased number of issues related to vaccination during pregnancy, but we welcome your expertise here. The next slide, Jose Romero. Is professor in the College of Medicine and Department of Pediatrics, the section chief of infectious diseases, and the Horace Cabe Endowed Chair in Pediatric Infectious Disease at the University of Arkansas for Medical Sciences, Little Rock. Jose has served on VRPAC in the past, is very interested in healthcare delivery and research among underrepresented minority communities. But he brings forth extensive knowledge and expertise in molecular virology, pediatric infectious disease, and vaccine science. So we welcome Jose. Next slide, please. So what do we do? Next slide. This is a picture or a tracing of the first ACIP meeting, and realizing that people can't see the agenda topics included here are influenza, pertussis, smallpox, and measles, and I believe rubella as well. Next slide. That taken from the charter, our role is to provide guidance on the most appropriate selection of vaccines, looking at populations and groups and or circumstances for which these should be used. Keep in mind disease epidemiology, burden of illness, vaccine efficacy and effectiveness, safety, economic analyses, and implementation issues. And then also, we are stewards for the Vaccines for Children program. I'm not sure if this next slide is going to work, but we'll give it a try. And if you touch on the screen, we'll see if this works. Yeah. I'm not sure if we have audio. And unfortunately, we don't have audio, so we can probably skip through this, but this is just talking about the challenges of herding cats. And I think over the 50 years of ACIP, we've done a fairly good job there describing how they get beat up in the process, how it's a job that they absolutely love. But I encourage you just to go to YouTube and click or type in cat herding, and this will pop up. We bring together information, ideas, and technologies and make them go where you want. Okay. Next slide. Where do we do this? Next slide, please. The very first meetings were held in room 207 in Building 1 at CDC. I think a couple years ago, before the building was taken down, Doug Campos-Outcold and I were taken on a field trip to actually look at this. The room actually would not even accommodate our central table here. So if you can imagine the evolution from room 207 to next slide, the current location in the Global Communication Center. Next slide. As to when we meet, next slide, is pretty straightforward, 3 times a year in February, June, and October, and sometimes in August as we had our live teleconference that I believe serviced nearly 1,200 attendees by the web conference back in August. Next slide. And then why we do this. This is published this year, and just looking at the number of cases of disease prevented for the cohort of children born between 1994 and 2013, so a 20-year slice. And keep in mind the numbers at the bottom line in total are multiplied by 1,000. So the estimated illnesses averted is 322 million. The number of hospitalizations, 21 million, and the number of premature deaths due to vaccine-preventable illness in this cohort estimated at 731. If you're a numbers person, if you look at numbers needed to vaccinate to achieve the reduction in illness is 0.24. Compare that to any statin out there, and you'll see the effectiveness of vaccines. The number needed to treat for hospitalization is about 4. So just a phenomenal effect. And unfortunately, the next 2 slides are not going to work, but I'm going to have Jean click on them because we don't have audio. But I'll just describe this. Laura Huber is a Wisconsin mom who, I believe about 7 years ago, gave birth in July or August to a set of twins. And in this clip, she describes one of her twins who is now hospitalized and coughing to the point of turning blue and even black. And if you just go to the next slide, Jean. In this clip, she is describing the autopsy of her son Abe, who died at 5 months, but from pertussis. But she concludes by saying, the worst part is I think he got it from me. But I encourage you, if you, again, just go to YouTube and just type in my pertussis story. This will be the first thing that pops up. But for people who are unconvinced about the role of pertussis protection and Tdap during pregnancy, I encourage people to go here. Next slide. So this is the last, and just a quote that I like very much from a book published about 10 years ago. But if you click again, and just bringing forth, over the time of ACIP, we've seen the global eradication of smallpox, we've seen measles elimination in the United States, and we're on the verge of global polio eradication. So that's it. Happy 50th ACIP. And one more click. And we will, I think, to keep on time and make room when Dr. Frieden shows up, if we can get started right away with our agency updates, and I will call on Dr. Schuckett.
Thanks so much. Just 4 items quickly. Want people to know that December 7th to 13th will be the National Influenza Vaccination Week events and a chance to promote late season vaccination. We actually hope we're out of vaccine by that point, but if you can mark your calendar in case we aren't. Next week, CDC is going to be convening a blue ribbon panel around immunization information systems or registries to help define metrics for success for the future priorities that we're trying to implement. I want to briefly mention Ebola vaccines. I know everybody's very interested in the Ebola response, which is, the highest priority for our agency right now and what many staff are involved with. CDC is working together with others across the U.S. government and partners in West Africa, industry, and other countries in trying to accelerate vaccine evaluation and potentially availability for Ebola. The epidemic's evolution is such that the thought that we may actually need vaccines to be able to finally control it. CDC's primary role at this point is working on a stepped wedge vaccine design plan to be implemented in Sierra Leone and possibly additional locations. We have a team in Sierra Leone now working with counterparts in the government as well as the UK, and trying to flesh out plans for that. At the same time, I think you'll hear from NIH about their efforts to try to develop a randomized controlled trial for implementation in Liberia. I was able to attend a meeting last week at WHO, bringing together the stakeholders and folks who are keen to make progress as rapidly as possible. And the focus of the work that we're developing would be to target vaccine evaluation for the healthcare workers and other frontline caregivers in Sierra Leone. So stay tuned on that. I know people are interested, and I'm happy to talk to people during the break. The last item is a very good piece of news that I wanted to share. Starting October 1st, Nancy Massonier has joined us as the Deputy Director for the National Center for Immunization and Respiratory Diseases. Nancy's over there, probably known to many of you for her expertise in bacterial meningitis, pertussis, as well as infectious disease prevention and response. She's going to be working closely with all of you, I think, in the immunization effort. So welcome, Nancy.
Thank you. CMS and Dr. Hans.
Thank you. I have two brief updates. The first is that we're in the process of updating and clarifying the Medicare coverage of pneumococcal vaccines given the new ACIP recommendations using an expedited process. I don't have anything more to share at this point, but we do anticipate that we'll have more information to share at our February meeting. Also, we have worked with NVPO again this year to release weekly information on flu cases in Medicare. The flu map and flu trends data is available on the NVPO website.
Thank you. Dr. Geib for Department of Defense.
Yes, good morning, everyone. There really haven't been any new immunization policies since the last ACIP, other than just an update on the annual influenza guidance. The DoD goal is 90% for the service members by 15 December of this year, and that's expected to be reached as it was last year. And one other comment, although I will remain involved with ACIP, there'll be a DoD replacement or representative for, excuse me, for the next meeting. So just let you all know that. And then lastly, we mentioned the Ebola response, and I just wanted to put a shout out. There's actually, excuse me, the Ebola responders are going to be getting their influenza shots today down in the USC. So that's it. Thank you.
Thank you very much. Department of Veterans Affairs and Dr. Kinsinger.
Good morning. I just have three things to mention this morning. First is to announce that the VA has launched its VA Retail Immunization Care Coordination Program. It's a first retail partnership with Walgreens. It was launched in September. And information about certain vaccines given by Walgreens pharmacists to VA eligible veterans will be sent electronically to their VA medical record and will be viewable by their VA providers in the regular place where all immunizations are recorded. For this year, information about 3 vaccines will be transmitted to the VA electronic record: influenza, pneumococcal, and zoster vaccine. And VA is funding about 75,000 flu vaccines for veterans enrolled in VA for healthcare. All Walgreens stores across the country are participating, and other retail pharmacies will be added as the program is expanded. Second is to mention that we're working to update our clinical guidance and electronic clinical decision support tool we call Clinical Reminders for the pneumococcal vaccination to be in line with the recent recommendation about PCV13 in older adults. That'll be in place in a couple of months. And we're also working on developing a clinical reminder for the Tdap-TD vaccine, and we'll begin development of the zoster vaccine clinical reminder. And then third, just to mention, week 42 influenza activity is low across the VA as it is across the country, looking at number of hospitalizations and ILI visits, testing, and positive laboratory results. Since August, there have been about 900,000 doses of vaccine given to veterans in our healthcare system.
Thank you. Dr. Sun, FDA.
Good morning. Just wanted to update a couple of things from the FDA. We are very busy. We have prioritized the review of the 2 meningitis B vaccines by both Pfizer and Novartis, and those reviews are ongoing, and we anticipate a regulatory action soon. We also are very much involved in the Ebola outbreak response, working with other agencies, including CDC and NIH, as well as other regulatory agencies, on putting the available vaccines into human testing. A couple of noteworthy approvals since our last meeting. One, and which will be discussed later in this meeting, is the approval of Afluria to be given by the PharmaJet Stratus needle-free injection system. This approval was based on an immunogenicity non-inferiority study in approximately 1,200 subjects, 18 to 64 years old, with a 1-to-1 randomization. The other noteworthy approval since the last meeting is the approval of Menactra for use for a booster for ages 15 to 55, and this was evaluated as a open label study at about 834 subjects who have received their last dose 4 to 6 years ago and who are greater than 11 years old. Thank you.
Thank you, Dr. Sun. At this point, I have the pleasure of introducing Dr. Tom Frieden, Director of CDC, who will make some comments here.
Yeah, Tom, we really appreciate your being here. I know you've been fairly busy with other activities, but this is, as you know, the 50th anniversary of ACIP, which is a big event for us, and we really sincerely appreciate your being here. And you're welcome to stay for the whole meeting.
Thank you. Thank you very much, and thanks for all that you do. ACIP is a wonderful example of what we in the public health community aspire to, which is making sure that we're making decisions based on data openly and objectively derived in a public process, and then having that information be widely adopted throughout the country to save lives. And I want to welcome the 3 new ACIP members, Ed Bologna, Laura Riley, and Jose Romero. Thank you very much for dedicating your time and efforts to this. This is the 50th year, as you know, of ACIP. Last week, we published an MMWR detailing the history of ACIP. And of course, a lot has changed in that 50-year period. We have a lot of new vaccines. We went from 6 to 16 childhood and adolescent vaccines, and now 15 vaccines for adults. In my first ACIP meeting as director, I teased one of the members that you're turning our children into pincushions with all of these vaccines. And he says, no, we're doing that to adults also. And we still have so much further to go, both in closing the gaps between vaccine recommendations and vaccine delivery, and in developing new vaccines that are even more effective against more diseases and that will protect more children and adults and save more lives. And ACIP will continue to be central to that process. We've made a lot of progress. Flu season is upon us, so we're thinking about flu vaccine. We're also thinking about pneumonia vaccine and how important that is for our health. We're thinking about the kind of connectivity that we all have, because we've learned that if we control disease in one population, it protects other populations within us, whether that's Haemophilus or pneumococcus. We're seeing rates go down generally when we increase childhood vaccination rates. And as we increasingly vaccinate against flu, we're hoping we'll see that in influenza as well. We know that the pneumonia vaccination recommendations are complicated. They're new, but they're important because pneumonia and pneumococcal disease is an important disease to fight. Of course, PCV13 is still included in the standard childhood vaccine schedule, and the PPSV23 is recommended for children at higher risk as well. Public health is a best buy, and vaccines are a great demonstration of that best buy. As we work to stop Ebola in West Africa and protect Americans from it here, we're looking very carefully at 2 vaccine candidates. They will undergo, we hope, in the near future, randomized trials. One standard randomized clinical trial, another potentially a stepped wedge design that CDC may be leading. This is important because vaccines are very powerful weapons, and we need to look at where vaccination can play a role in disease control anywhere it might be possible. So it's just yet another reminder of how critically important vaccines are to our health and what a strong tool they are for disease control. So I want to thank you all for the work you do. Thank you for saving lives. Thank you for keeping our kids and adults healthy. Of course, I know you've all had your flu vaccine already, but if for some reason you haven't, please do get flu vaccine. And ultimately, the role of ACIP, as the role of CDC is, to rigorously look at what the science shows, to openly state what we know and what we don't know, to set the best possible policy based on the best possible science, and then to support all of our partners in state and local health departments, in hospitals and health centers, in communities and patient advocacy groups, to get the best possible recommendations implemented, provided, information given to patients and doctors so that we can protect as many lives as possible. Thank you for the work that you do.
Thank you, Dr. Frieden. We will continue with the agency updates, and I see that Dr. Houston is here. So from HRSA.
Good morning, everyone. The Advisory Commission on Childhood Vaccines has made recommendations to amend the vaccine injury table on several dates, the latest being September 5th of 2014. And these recommendations are based on the Institutes of Medicine's review of the scientific literature on vaccines and adverse events. These recommendations are being considered by the agency. I also wanted to inform you that increasing numbers of petitions are being filed by the National Vaccine Injury Compensation Program each year. In fact, during fiscal year 2014, we had the highest number of claims that were filed with the program, which was 611. Increasing number of claims are also being compensated. In FY13, 351 claims were compensated, and in FY14, 365 claims were compensated, and over $200 million were paid in compensation to petitioners. The Vaccine Injury Program, which compensates individuals and families of individuals who had been injured by vaccines, which is a rare event, is an alternate to the traditional tort system. We have instituted an outreach campaign in order to inform people that this is a safety net that's available to them in the event that they have been injured from vaccines. We'll be reaching out to partners to be able to promote awareness of the program. Thank you so very much, and have a good day.
Thank you. Ms. Groom, Indian Health Service.
Thank you. Good morning. Just a couple of updates. The first on influenza, of course. We are beginning our campaigns quite aggressively on that. IHS has developed a new influenza vaccination action plan with the goal of aligning with the Healthy People 2020 goals, and are looking at a number of different strategies, including performance measures to help us achieve that goal. We've administered 184,000 doses of flu vaccine to date in our patient population. And the other thing I just wanted to report on is our clinical reminders. We are rolling out our hepatitis B reminder for those with diabetes. That will be going live in the next week. And then we, of course, are working, like the VA, on the PCV13 one and hope to have that rolled out in the next month. Thank you.
Thank you. Dr. Gorman, National Institutes of Health.
Good morning. I'd like to start with something that's tangentially associated with ACIP, which is the NIH's continued interest in antimicrobial resistance. And we're involved through our antimicrobial resistance leadership group, working on stewardship, behavioral changes, the development of new antibiotics, and the exploration of the role of vaccines in handling the continued problem of antimicrobial resistance. The NIH and the CDC are working together collaboratively to put together a clinical trial for coccidiomycosis valley fever in the affected areas of California and Phoenix, and that trial is well on its way to develop with a hopeful implementation in summer of 2015. Our HCV vaccine candidate trial continues to enroll well, and we're hoping that someday soon we'll have some results for that as well. We're about to go into the clinic with our first broadly protective, or alternatively called universally protective, influenza vaccine. And again, hopefully that will be somewhat time in the near future. And as for Ebola, I'd like to start off by echoing Dr. Suckett's statement. It takes a village to save the world. This is an incredible effort on the part of the U.S. government, other governments, NGOs, healthcare workers, the pharmaceutical industries, all working together in partnership to try to push these agendas forward. At the present time, NIH's role is throughout the entire spectrum of development of these agents. At the present time, we're looking at 5 potential therapeutics and 3 potential vaccines. We're looking at preclinical targets. We're testing previously approved medications to see if they may be effective against this particular agent, as well as looking at the ones that are specifically developed. We have accelerated toxicity studies for the vaccines to meet some FDA requirements, and we have broadened or expanded the number of non-human primates in studies to get better data on potential correlates of protections, and using system biology to look at the differences between the vaccine candidates that protect and the vaccine candidates that do not protect the non-human primates. We are presently finished enrolling 1 phase 1 vaccine trial in the United States for 1 candidate vaccine, and we're in the planning stages for several other potential phase 1, phase 2 trials for different candidates. In terms of the potential efficacy or effectiveness trial, the considerations continue to be the best possible design that is implementable, that will give data that will give us confidence that these vaccines work and are safe and effective. Thank you.
Thank you. Dr. Ornstein, National Vaccine Advisory Committee.
Just a couple of things in terms of where the NVAC is headed. One, the NVAC has already put out a report on enhancing uptake of vaccines recommended for pregnant women. It's now embarking on its 2nd phase, which is how do we incentivize development of vaccines intended for pregnant women, both existing vaccines with that indication and new vaccines that we intended for that group. Number 2 is we're very involved in a review of the National Vaccine Plan. It is the mid-course review. It is a 10-year plan. It's coming up on halfway in 2015, and we'll be working with the National Vaccine Program Office and potentially making recommendations for change. Number 3 is we have 2 working groups. One is how do we improve uptake of HPV, and we hope to have recommendations soon. And a 2nd working group dealing with vaccine confidence or / hesitancy and how to overcome that. And we expect to have some preliminary recommendations to review at our next meeting.
And we'll move straight over to...
Sure, thanks. 3 things from me. The big news is that late last week, Secretary Burwell announced the appointment of a new Acting Assistant Secretary for Health. Karen DeSalvo was and maybe still holds the reign as the National Coordinator for Health IT, an area that doesn't go unnoticed in immunizations, and she's already started. For those of you who don't know her, she was, before coming to HHS, she was the Health Commissioner in New Orleans and had lots to do with rebuilding the health system there after Katrina. The other 2 pieces are with CMS. We've put out a piece in Medscape that's explaining ACA and immunizations. There are resources there and Q&As. It's intended for providers. And third, I want to thank you for bringing Dr. Frieden to introduce the importance of adult immunizations. And in a watch this space, we're in the process of clearing an adult immunization strategic plan that you'll have a chance to look at some point when it's a draft. We'll look forward to all of your input. Thanks.
Thank you, Dr. Gillen.